All right, good morning again. My name is Lawrence Sanders, and I have the privilege of moderating the second session. We're going to continue our opportunity to learn and better understand lung cancer. I think that how I would like to frame this is that in the previous talk, you heard about the diagnosis, you heard about treatment options, and how outcomes have improved across time. What I'd like for our panel to do now is talk about how we got there. So what we're going to talk about will be the topic of clinical trials. Clinical trials represents a type of research where we compare different methods of treatment to different things. Clinical trials really serve as the workhorse for improving our capacity as physicians and as the healthcare system to care for people. We're going to have a panel. Each panel member will tell their story about their journey with lung cancer. After that discussion, we will have, after each panel member, or when that's all done, we will then have a discussion about clinical trials and how it all fits into this space. With that, I'm going to go ahead and introduce the members of our panel, and each will come forward after that. On our panel is Mr. Reginald Vicks. He is the Chief Operating Officer at the Crescent Community Health Center here in New Orleans, Louisiana. And then I also have Daryl and Diana Honoré Montana. Mr. Montana will tell his story, followed by his wife, who has served as his caregiver. And then we also have Ms. Lynn Bell, who is an advocate working in this area, and she will tell her story. After all the stories are complete, I'll come back and summarize, and then we will have a discussion, and there will be time for question and answers. With that, I'm going to bring Mr. Vicks to the podium. If you want to sit there, that's fine as well.
So I think I'll sit, if you don't mind. So good morning, everyone. So I serve as the Chief Operations Officer for an FQHC, or a community health center here in New Orleans. But I'm also a patient. So I'll start with that component of my story. About 5 years ago, my family and I were going on vacation. And interestingly, my neck started to itch, and when I was massaging that area, I felt a lump. And something unusual had never happened before, right around my clavicle, my left clavicle. So didn't tell anyone about it. We went on vacation, had a great time in San Diego. Got back to New Orleans, and my wife and I talked about it, went in for an exam. One thing led to another, and I was diagnosed with lung cancer. So that began my journey. Had been a smoker for about 20-something years, off and on, and worked 12 hours a day, work out every day, every other day. Never really thought that anything like that could happen to me. So fast forward, we made the decision, my oncologist and I, to go for curative treatment. At that point, there were a mixture of cells that they couldn't even identify, so they had to send some of my specimens to the Cleveland Clinic for further examination. So it ended up where I was not a candidate for surgery, and so we began with chemotherapy, followed by immune therapy and high-dose radiation treatment, 30 treatments of radiation. So that's, how it all started. This year is 5 years with no recurrence. So I would say, so I didn't tell you that I'm also a nurse. And so we can be the worst patients, I can tell you that. One of the things that I really identified, thinking that I work in public health, I'm always coaching clients about, prevention and getting screened and everything else. Well, I hadn't seen a primary care physician in 10 years. So, my first mistake. And also staying in tune with your body. When things change, when you start feeling that something is a little bit out of sorts, in our communities, we tend to push through and say, I can work through it, I can work it out, it's going to pass, and so on and so forth. I mean, that's how I grew up. And don't take it for granted. So prevention has become my mantra now. And as I seek to encourage others to get early screening and to really focus in on their health and wellness and to pay attention to what your body is telling you. It's also affected my work life from the standpoint of refocusing our providers and our priorities around different types of cancer screening that we really don't think about. I wasn't really aware of the different types of lung cancer screenings that can be done in advance as a part of a prevention plan for maintaining health and wellness. So this has been a journey of education and learning as well as resilience. I would say that I'm motivated, and I have been motivated, and I know some of the other panelists are going to speak to this as well, to fight for a cure for myself. I could have taken the route of palliative treatment because I was stage 3 and I had aggressive cells that nobody knew. I had 3 different types of cells in one tumor. And so it was kind of unusual. But by the grace of God and some great physicians and new therapies and science and research, I'm still here.
Pass it down to Mr. Montana.
Justin. It's my
Go ahead, sir.
good morning. How I get here? It's been a journey. Started off at first, I would get these dizzy spells. I would get dizzy, and I thought it had a lot to do with hypertension because I do have high blood pressure. So I thought maybe it was the medicine. Sometimes when the medicine drops, it kind of makes me, because I'm used to having my blood pressure 130/90, and when it gets normal, 120/80, it kind of had me lightheaded. Well, anyhow, I started having these chest pains, and I was already seeing a doctor. I was seeing doctors like every month, and I had this pain in my chest, and when I wound up going to the urgent care, and they gave me a steroid shot, and the pain went away. Then 6 months later, I got the pain again. And they gave me a steroid shot. But the thing that bothered me was what's causing the pain. So later on, they tell me that they're watching my blood count, my white cells, saying that my white cells was 15,000. It went up to 33,000. So they wind up sending me to infectious disease control, and found out I had leukemia. But I'm still having this pain. So they wind up having me to go have a CAT scan done. Because, I've gone to the ER, I've had like 9 doctors in the room. They looking at my heart, and there's something else going on. So they wind up doing a CAT scan on me, and come to find out, I had stage 4 lung cancer. So here I have blood cancer, lung cancer, and a brain tumor. The hospital had put me off. First, they put me off for 6 weeks, no, 3 months. And then when I went back, they put me off for 6 weeks. I'm having all this pain. So my wife, my caregiver, she said, Darryl, we got to do something else. She said, because it appears they wasn't taking it serious. So she put feelers out for referrals. One of her friends was dealing with cancer, had us to go to her doctor, a doctor by the name of Jane Gertler. Saved my life. Saved my life. At first, the first day when we first reached out to her, we called. She said, can you come in tomorrow? Now, mind you, they had been putting me off for 3 months and for 6 weeks, and she said, come tomorrow. So when we go in her office the next day, while we're in the office with her, she called the guy that had to do the biopsy. His name was Harry Roach. Called him, said, Dr. Roach, I have this gentleman here. He's such a nice guy. She said, want to know if you can help me out. We need to have a biopsy done. So 5 days later, they had the biopsy. I had the biopsy done. Before she had my port put in, she went right straight at my vein, and that's how I started my treatment. In fact, she was waiting on, she had 3 tests she was waiting on. She had gotten 2. And so the first time I got my chemo, I only just got the chemo. She hadn't got the 3rd test back, so the next time I go back, because I have to go back for treatment every 3 weeks. The second time I went to get treatment, she gave me chemo and immuno. So when I went to go get my stitches out, Dr. Harry Roach asked me, well, how's things going? I say, pretty good. I say, she had me on chemo and immuno. He said, she's giving you the mother load. So two days after I had got my treatment, I went in to go and have my port put in. So I've now been getting treatment 18 months. She initially gave me a 20 to 30% chance of living for 4 months. It has been 18 months. It's been 18 months. It's been a journey. The chemo was tearing me up. She told me, she said, we're gonna do 4 treatments, and when we got to the 3rd treatment, she said, I might do a 5th and a 6th. And I'm looking at her because now I'm really catching hell with the treatment. And I told her, I said, I don't know, doc. So she wound up just doing the 4 treatments. And then she continuously did the immunotherapy. And I'm still here today by the grace of God. Because the first 2 days, the first 2 nights I found out I had cancer. I didn't know what kind of cancer I had. I just knew I had cancer, but they were talking about leukemia. But then I find out not just leukemia, you have lung cancer too. And it had gotten to the point, it was stage 4, it had gotten to the point where I sneezed and I heard something break. It was my 5th rib broke. It had spread it to my bone, or my ribs, and But the thing about it is that, and I say this all the time, and I think I've mentioned it to this gentleman here, is that I believe in my treatment, it had more to do with my mental state. I'm a Mardi Gras Indian chief, a black masking Indian chief, and I was trying to finish my suit. So I couldn't really entertain being sick, you know. I just kept pushing because I needed to finish my suit. And I started dressing in 1964. This was my 52nd year. My father, Big Chief Allison Tootie, Montana, did 52 years, and I had to do my 52 years. So that inspired me to keep on pushing, in spite of, and what I try to do is use my story to help somebody else. Because it's God works through people. And a lot of times, folks looking for God, but he worked through people. And if it had not been for Queen, Dr. Gertler, and all the other people that supported me, I don't believe I would still be here. I am truly honored to be in this position where I can try to help somebody else. I've worked in a social service field, so I was always one helping folks. So I thought, well, let me take these lemons and make lemonade. Amen. And that's where I'm at today. And thank you all for having me.
All right, thank you very much, sir. We have the unique privilege today, though, to also hear from Ms. Diana Montana, who was here with him the whole time, and I'd just like to give her an opportunity to share her perspective from what it was like to be a companion and a caregiver through this journey.
Good morning, everyone. So, first of all, I'm a 3-time cancer survivor over 40 some odd years. My first cancer was when I was 17 years old. At any rate, and I'm also a nurse, so I look at it from a few different perspectives. When Daryl had started having chest pain, you know, he was going to the doctor, as he said, he was going to the ER and all this stuff, and I'm like, why are they not doing any testing? What's the problem? So finally, he gets an oncologist to deal with the leukemia. She put him off for 3 months. He goes back to the visit, and he tells the medical assistant, I can't live like this anymore. The pain is too much. So finally, the doctor comes in, she does her whole, you know, and then I say, well, why are you not doing any, what's the problem? This man has been having pain for 2 years off and on. Steroid shot is not cutting it. He's a former smoker. What is the problem? I mean, we went through doctor after doctor and nurse and whoever we could talk to. And it was just like, so finally at the end of the visit, she says, well, you know, we're gonna go ahead and give you the CT scan. I don't think it's related to anything, but we'll see. So I said, okay, we're finally gonna get, so he went to make the appointment. This was at UMC. He went to make the appointment. And I said, okay, I'll wait down, you know, over here in the hall. So he comes out, and I said, okay, when is the CT? When is the appointment? It was scheduled for another 6 weeks out. If my brain could have physically exploded at that point, it would have. So I got him home. I didn't want him to really see me upset. I got him home, and I got on the phone, and I got him a CT scan within 3 days. Well, he has patient portal. I go in his patient portal a couple days later, because I keep calling the doctor's office, I'm not getting any response. The entire report is there. I'm looking at the size of the tumor, where is that? And he's sitting across from me, watching me. He didn't know what I was doing, But I'm looking at this thing, and I'm like, how do I not fall apart, scream, or do something in this moment? I was not about to diagnose him from that report. It was a full report with the broken rib, the metastasized cancer. So I kept calling the doctor's office. Oh, she's out. So they had another person filling in, and she said, oh, I'm sorry, we didn't call you. I said, this is not even supposed to come to us. A report like this is not even supposed to come to his patient portal before somebody reads it and is responsible enough to either call or have us in the office. So, well, of course, she felt bad at that point. Well, that's when I put my feelers out. My last cancer was breast cancer. And so I wanted somebody who worked with lung cancer patients. So that's why I put my feelers out for another physician. And so finally we found one, you know, and I mean, she was on everything. She was a godsend, really. So, you know, and it's been very difficult for both of us. You know, it's very hard as a caregiver to say, this is hard. You know, I would run into people, and the people that had lost loved ones or were taking care of loved ones, they would come to me first and say, well, how are you doing? You know, we often forget about, you know, and as a nurse, it's a little bit different. Of course, you have a workload, you're taking care of people, you care about people. But when it's somebody this close to you, it's a little bit different as a caregiver. And being home and being 24 hours a day, you really do lose yourself. So I was very grateful for those people and that support. But thank goodness for Dr. Gertler. He has, and his attitude, you know, and I don't know if you all know, because I know there may be some people not from here what a Mardi Gras Indian is or Black Masking Indian is, but they wear these huge, giant, feathery, beaded suits. And while this was right before he was diagnosed, he was working on this suit, like in excruciating pain, to where he would just have to stop and sleep and wake up a couple hours later and start to sew again. And the sewing is what gave him life. And the singing of the Indian chants. And I don't know how he did it, but by St. Joseph's night that year, he finished the suit and he came out in it. And the suit is a lion head. It's like 2 lion heads. So I hope y'all get to see it one day. But so not only did he do that one, but he did one for this year, and we're getting ready to start for next year. So, but I guess my biggest takeaway is, caregivers, I feel you. But the system is so broken. It's broke, you know, there's bias, there's racism, genderism, ageism, people that, you know, and I always say, I'm just a nurse, and you have these trained oncologists that are ignoring. How can you ignore a man who is having, you know, 10 on the pain scale, chest pain, smoker for 20 some odd years, you know, and all sorts of other symptoms? How can you sit there and doctor after doctor ignored that? That's a shame. That's sinful. That is sinful, you know. And people always ask me about my cancer. You know, a lot of people in my family have had cancer, but I've had all sorts of genetic tests and everything. They can't find anything. And I keep going, well, what about the air and the water and the food I'm eating? So all of these issues are continuously ignored, you know, and I just wish healthcare professionals were held more accountable, as well as our elected officials with regard to our air and water and the food we eat. Thank you.
Thank you very much. I think you really point out the importance of advocacy and someone there to be really working in your interest as a patient. Our next panelist is Ms. Lynn Bell. She is an advocate for lung cancer and a survivor, so she's going to tell us her story as well. Ms. Bell?
Good 1, 2, 3. Good morning. I was a smoker, but I had quit in 2016. 2021, I just kept passing out. I was going to the doctor. I had every test there was. The only test that they never gave me was a chest x-ray. So I passed out one night, ended up at a hospital. They did a CT scan and a chest x-ray. And the guy comes in and he says, Miss Bell, you got a spot on your lung. I just knew then that I wasn't going to be here. I knew it. I tried to hold steady. I kept believing. But it was really, really weighing on me. I was kind of upset because I kept saying, I was going to the doctor for about a year. And you mean to tell me that they knew I was a smoker, but yet you never said, well, let's do a chest x-ray. So when Monday came around, I had to make a phone call to my primary doctor. And then she made a phone call to the person that was going to do the, you know what I'm saying. Yeah. And then after that took a while for the results to come back. When the results came back, it was stage 4. And I couldn't even be angry, but I was a little hurt. I wasn't a little hurt, I was a lot hurt. I was hurt. So I did everything that they had asked me to do after that. And I'm thinking that, I'm going to this chemo session and I'm going to be better, and no one ever said that chemo lasts for 9 months. So after that, I kept saying, no one's really saying anything, so I started asking questions. Thank you. So I started asking questions, and I asked my oncologist, is there a clinical trial that I can join, get into, participate in, because I want to be here? And she said, well, it is. They kept getting the numbers wrong. Every time I called, it was for the appointment. So I kept emailing her. She called me back and she said, I'm sorry, call this number. I called the number. Excuse me. The doctor answered. And she made an appointment for me to come see her. And I was so excited. And I get there and she's just yap, 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 yap. But this is her job. She had to. But in my heart, I'm saying, lady. She said, well, I only have 1 seat left. And I said, lady, would she just be quiet and let me sign the paper? So after we did all that, signed the paper, it has been a glory to God to be able to find what I found. And I'm still here. I am still here. So I tell people all the time, go to the doctors. You know, if you smoke, make them give you a chest x-ray. If you have to go in and say, oh, I'm hurting right here, make them give it to you. Because if they don't give it to you, you would never know. You will never know. And I just think that with health insurance, that should be mandatory. You shouldn't have to ask for that. I think if they know you're a smoker, and they know I smoked, you should have said, well, Miss Bell, let's just give you. And I could have found that way before all this happened. But I am grateful. I'm very grateful that I'm on this, in this clinical trial, doing good. I don't have any complaints. When I first started, it was horrible. I'm not gonna lie. I mean, I was feeling bad. I even walked up to them one day. They looked at me, you're not supposed to be here today. I said, I feel bad. And then after that, I realized that once it had to enter your system, and once it entered your system and got there, and I'm good. I'm working. I work sometimes 8, 16 hours. No problem. So, I mean, I have nothing else to say but thank you, Jesus, for putting me in contact. Can I say the name? Amgen. Amgen did it.
All right, so thank you very much, Ms. Bell. I think Ms. Bell talked about her experience with clinical trials. Mr. Vick, you said that you were not eligible for a clinical trial. But I would open this discussion, and I'm going to come back to Ms. Bell, because actually I might start with you, Ms. Bell, if it's okay. You said that you asked your physician about the clinical trial. It was not offered to you.
No.
And what was the reaction of your physician initially?
You said what now?
How did your physician react initially when you asked?
You gotta talk a little louder. I told
Okay,
you that.
you told me that earlier. All right, so when you first, tell us your experience. Let me try it a different way. Tell us your experience after you asked about the clinical trial. You talked about it, but one more time. Tell us your
About the
experience.
clinical trial?
Yes.
She had said yes. She said that she needed to check, and she said, but yes, there was a clinical trial. And so I was waiting on her for a period of like 3 weeks. I was waiting on her for like a period of 3 weeks. And I said, let me text her, message her. So when I messaged her, they gave me a number, and when I called the number, I was so excited. And it said, it started giving you different, if you needed an appointment for this, press 1. And I just hung up. So I messaged her again. And then the second time I messaged her, she said, oh, that's the wrong number. And then she had given me the correct number. And that's how I got in contact with who I needed to get in contact with to still be here.
Mm-hmm. And was it difficult for you to get to the appointments for the clinical trial? How hard was it for you to get to the appointments for the clinical trial?
You said what now?
Was the clinical trial hard to participate in?
Yeah. Yeah, I'm still on it. Yeah.
Okay. All right. Now, for the other members of the panel, although you were not in clinical trials, did you have any reservation? Would you have participated if it had been offered? Yeah, go ahead.
Probably, but it was never offered to me. My question was to this. My question to the doctors was this. Having Queen was an asset for me because she knew how to get me through the maze because at that time, I couldn't function. As far as appointments, I had 6 appointments in 4 days. And I asked the doctors, I said, well, what happens to folks who don't have what I have? And you know what they said? They die. So, you know, you gotta have somebody to advocate for you, because a lot of that stuff I didn't understand. And if it had not been for Queen, because I probably would have stood where I was at, let them keep giving me appointments. I'm looking at myself, I've lost 25 pounds in 2 months. And I'm working on my suit. I'm helping somebody else, and I'm looking in a mirror that I don't normally look in. And I didn't say anything to Queen nor to the people that I was helping. But I look in the mirror, and I say, I'm dying. I saw it. But I don't look like that person today.
Amen. All right, and Mr. Vicks, I think you talked about the different kinds of cells that you had and the stage of your at your diagnosis that you were not eligible for a clinical trial. All right. At your health center, have you taken any efforts to kind of introduce clinical trials or thought about that as a possibility for patients with the same diagnosis?
So we do incorporate research into our primary care services. Not a lot has been done for lung cancer. You know, the traditional screenings, colon cancer, mammography, you know, colonoscopies, mammography, for breast cancer screening, looking at lab values for markers, the usual stuff that happens with any primary care physician's office who is really focused on prevention, which is not always the case. I would say that I am now the impetus for that because of my own personal experience. And this is something that, you know, I'm going to focus on lung cancer specifically, but there's something that it's not really focused on. Even though we talk about tobacco cessation and smoking cessation, you know, and plug people into programs to help them stop smoking, or, you know, maybe look at the environmental factors from a public health perspective, as far as exposure is concerned. You know, different occupations present challenges as far as preventing exposure to carcinogens and other things that could affect your lungs and other systems in your body. I would say for me, one of the things that, and I think I'm echoing the other panelists, is advocacy. And first of all, training medical professionals how to advocate for their patients. You know, I think we've all had similar experiences. I was very fortunate, I am very fortunate, my wife is an oncology nurse. And so, and now, hey, you know, that could be, when I was going through the process, you know, she was a motivator, she was a super motivator for me, in which some days I was like, okay. But I'm glad she did that. I'm glad she pushed me, because I didn't really think that it was as serious as it was. I'll give you an example of the advocacy piece. I was diagnosed right at the beginning of, right prior to Hurricane Ida hitting New Orleans. And so they gave me a date to start treatment. You know, I'm calling every day, everything's set. Oh yeah, you know, you're all set. Then Hurricane Ida hit and the city lost power for almost 2 weeks. A large swath of New Orleans lost power. So I'm calling and saying, hey, you know, my treatment was supposed to start today. What's going on? Oh, well, we don't have any power. The CT scanner's not really working. You know, we're going to get power, so we're going to postpone it. We're going to postpone it. It was very interesting because I was getting frustrated. And I had a case manager with my insurance company who called me and asked me how I was doing. I told her the story, and she said, well, is there somewhere else you can go to start your treatment if you don't know when it's going to begin? So I was making plans to go to Dallas, Texas, where our kids are, to get treatment, to start. And, you know, fortunately, one of the facilities got power here in New Orleans, and so they called me and I went in and started my chemotherapy. But if it wasn't for advocates, I would have been really stuck. I went through all the delays of getting in. Oh, we'll do the biopsy in 3 or 4 weeks. And I'm like, no. You know, I already know I have a diagnosis. You just don't know what it is and how to treat it yet. You need to do this so my doctor can facilitate my treatment plan. So I'm really, this is really resonating with me, and I hope it resonates with everyone in here, that there's really a foundational piece, in my opinion, around educating and training providers on how to advocate for their patients, but also educating our community on how to advocate for ourselves. So I very much appreciate this summit.
All right. As we wrap this up, I want to say thank you to each of our panelists. I want to thank you for the courage to share your stories, to give other people an opportunity to learn. I think one of the several of the themes that I've heard as we've walked through this, I'm going to pick up on the advocacy, both advocating for yourself and for your physicians to advocate for you on their behalf. The other thing that I heard loud and clear is that sometimes you just got to tell us as physicians what's going on, and if we don't listen, you need to move on. So I think that's one of the themes. But I want to wrap this up to really talk a little bit about clinical trials. I think Ms. Bell laid it out very nicely in that she was excited to be in a clinical trial. So often people will say, I don't want nobody doing research on me. But it is important because it is the only way that we learn and move science forward. I would also say that some of the concern around clinical trials is the safety, is the equity, and so much of what we often think about clinical trials when we go back in history and think about how many of us as African Americans were misused in clinical trials. I think the one that comes to mind most often is the Tuskegee syphilis experiment, but there have been others along the way. What I'd like to say is that since that time, many safeguards have been put in place to assure that clinical trials are safe and that people are informed about what the clinical trial is about and what the expectations are. But even in that world, it's very important that we advocate for ourselves and have people that advocate for us, be it our physicians or our loved ones or our family. The final thing I would say is that if we're going to continue to assure that everybody has access to the benefits of better health care, then we have to participate and be willing to participate in clinical trials, because the diversity of the population helps us understand better how new treatments, new diagnostic things, new prevention areas will work across a wide range of people. And it's not all about genetics, it's not all about race. It has to do with where we live, the environment we live in, and how it impacts how medicines interact. So clinical trials are important. I think it's something that we will continue to talk about through the summit, but I hope you had the opportunity to learn something from each of these stories, because every time I listen to a story like this, I have the opportunity to learn something, and I take it away. And if there's one thing that I would just share with all of you, listening is important. And if your physician or your your clinical professional is not listening to you and you don't feel like it's working, it's time to move on. All right? And I would ask our folks who are helping us out here, do we have any time for questions, or have we already come to the end?